My name is Dr David Boshell. I'm a vascular and interventional radiologist and I work at Sydney Adventist Hospital. We would normally perform progress imaging that we perform for people who have cancer. Now that may involve a CT scan, or it may involve a PET scan or an MRI scan. So the follow-up is usually very similar to the previous tests that have been done as part of that patient's usual care when they have a cancer condition. We would probably wait a couple of months, and that way we allow some of the early changes that might be confusing to interpret. For example, if the tumours swell, it can be difficult for us to know if that is because the tumours are responding well to treatment or if they're actually growing. So we would wait a couple of months, and we will also check blood tests if there are any tumour markers or other blood tests that we can certainly monitor to try and interpret to see if there is a disease response. We do tailor the amount of treatment that we can give. Some people have disease that is perhaps maybe in one area of the liver, and we can focus our treatment and be quite aggressive in that regard in trying to actually control and perhaps regress and maybe completely stop the tumour from growing. And in other situations, it may not be feasible for us to do that. So we may need to be more moderate with the dose that we give and try and reach a balance between having a therapeutic effect and not causing harm. So I guess there are some risks with any medical procedure, and with SIRT therapy it's no different. The immediate risk that we need to address is that we only put the treatment into the liver where it is supposed to have intended therapeutic effect. If we have the treatment go into other arteries and other areas of the body, it could have unintended radiation injury effects, particularly to the stomach or the bowel. That's part of the reason why we need to do an angiogram before we put any treatment in to see if one is eligible, and perhaps perform some additional procedures before we actually take someone to a SIRT treatment. After the treatment is in, we need to make sure that the liver is working correctly, and we will need to follow patients with blood tests and also clinically just to make sure that they've gotten over their treatment and that they're healing well.